This hearing will come to order. Today we meet to hear from U.S. Department of Health and Human Services Secretary Robert F. Kennedy, Jr. about President Trump's 2026 health care agenda. Mr. Secretary, thank you for being here. While I expect a spirited debate today, I would remind my colleagues that each senator is limited to 5 minutes, and we're going to try to keep that as tight as we can today. There's 27 of us, and we all probably are going to want to have our opportunity. At the end of the 5-minute time frame, I will gently tap the gavel if it appears that things are starting to lapse over, and encourage my colleagues and our witness to conclude their remarks at the conclusion of this time. President Trump and Secretary Kennedy have made a steadfast commitment to make America healthy again. Under this administration, HHS has placed patients at the center of the healthcare system, empowering them with the tools and information they need to create a healthier future. We know that chronic diseases such as heart disease and cancer and diabetes are some of the leading causes of death in America. Now the department has a renewed focus on tackling the root causes of chronic disease and promoting prevention first. I look forward to exploring ways that the federal government can further align payment incentives to support healthy living and fight chronic disease. The administration has also prioritized efforts to end waste, fraud, and abuse in our federal health care programs, including through eligibility and enrollment verification. This critical work is not just about saving taxpayer dollars. It's about restoring trust and ensuring vital programs like Medicare and Medicaid are sustainable for generations to come. In July, the Centers for Medicare and Medicaid Services, CMS, announced that the agency identified 2.8 million Americans who were simultaneously enrolled in multiple Medicaid or Affordable Care Act exchange plans. Stopping this duplicate enrollment while working with states to ensure that individuals do not inappropriately lose coverage has the potential to save taxpayers $14 billion annually. CMS has also taken steps to provide states with additional immigration information to verify eligibility for federal health care programs. Preserving lifelines like Medicaid for those who are legally entitled under the law will ensure long-term sustainability. Congress has bolstered these efforts by passing the One Big Beautiful Bill. This bill enacts common sense reforms to reduce improper payments and brings needed personal accountability to the Medicaid program. These reforms will protect Medicaid and refocus the program on the most vulnerable patients, those whom the program was intended to serve. The OBBA also created the Rural Health Transformation Program, the single largest investment in rural health care in decades, to help stabilize and modernize the rural health delivery system throughout our country. These accomplishments reflect a vision for a healthcare system that is proactive, efficient, and patient-centered. While many of the issues discussed today may be partisan in nature, this committee has a deep history of bipartisan healthcare accomplishments. I remain committed to partnering with this administration and Ranking Member Wyden to enact policies that realign incentives in the prescription drug supply chain, expand access to telehealth, and ensure long-term stability in our physician payment system. Mr. Secretary, I look forward to hearing from you today about the administration's efforts to make America healthy again and how we can continue to work together to achieve this shared goal. Thank you very much. Senator Wyden.
Thank you, Mr. Chairman. As the committee gathers today, the United States is in the midst of a health care calamity, the largest cuts to American health care in the history of our nation, and they are approaching like an avalanche. Last week, most of the senior leadership at the Centers for Disease Control and Prevention were fired or they resigned after refusing to bow to Robert Kennedy's unceasing crusade against vaccines. I traveled across Oregon last month, and the message was the same from one end of the state to the other. Families are confused. They're scared about who to trust about their health care. Robert Kennedy and Donald Trump have done so much to feed that mistrust. This morning, my staff, in partnership with Senator Alsobrooks' team, is releasing a report that shows the disaster of Robert Kennedy's 203 days in office. Every single day, there's been an action that endangers the health and wellness of American families. Robert Kennedy has elevated conspiracy theorists, crackpots, and grifters to make life or death decisions about the health care of the American people. Robert Kennedy's tenure is so far marked by 3 calling cards. One is chaos at federal health agencies, leaving families, doctors, and the entire nation confused and frightened. Corruption that benefits Robert Kennedy, Donald Trump, and their friends at the expense of taxpayers, and higher health costs for families. I ask unanimous consent, Mr. Chairman, to enter this report into the record.
Without objection.
Then there's chaos. It's been obvious from the start that Robert Kennedy's primary interest is to take vaccines away from Americans. During his confirmation process, he claimed to be pro-safety and pro-science, but his actions reveal a steadfast commitment to elevating junk science and fringe conspiracies. His agenda has not been about choices and information for families. Just last week, he threatened doctors that deviated from the new anti-science vaccine guidelines he released that make it harder for pregnant women and children to get the COVID vaccine. And then there's corruption. Robert Kennedy's bizarre statements and actions beg the question, why? Democrats on this committee answered that question months ago. Robert Kennedy can enrich himself and his allies. His family still stands to gain from class action lawsuits against vaccine makers. Now, Robert Kennedy fired every member, every single one of the group responsible for making vaccine recommendations to doctors across the country under the false pretense of conflicts of interest. Meanwhile, many of the new members of the panel are outright vaccine deniers who've appeared as paid witnesses in lawsuits against vaccine makers. Their conflicts of interest and ethics disclosures remain hidden under lock and key. On top of all this bedlam in American health care, just 2 months ago, Donald Trump signed into law the largest health care cuts in American history to pay for tax breaks for the wealthiest people and massive corporations in our country. Republicans know these cuts are going to hit communities like a wrecking ball. That's why they pushed the most severe cuts until after the election. That's why their members already introduced bills to roll back some of the cuts. Make no mistake, though, those cuts are being felt right now. We're seeing hospitals in Idaho cutting payments, hospitals and nursing homes. Providence Seaside Hospital in Oregon announced they're shutting down their labor and delivery unit. Every family is going to feel the burden of Trump care in America. Premiums are going to spike next year, especially for those who buy health insurance on their own, but the effects will be felt by those who get insurance also through an employer. Congress has an opportunity to extend the Affordable Care Act tax credits that lower the cost of premiums. Democrats are ready to pass an extension that stops a dramatic premium spike that would force many families to pay double what they do today. Instead of finding ways to help American families pay less for health care, Robert Kennedy is focused on his anti-vaccine mission, fueled by some kind of complex that the consequences be damned. Amid this litany of corruption and chaos, the one point I have to underline is Robert Kennedy puts children in harm's way every single day in America. To my Republican colleagues, I must ask, what line must Robert Kennedy cross before some of you will also join this alarm? This weekend, under the cover of darkness, Robert Kennedy attempted to disappear hundreds of children under his care at Office of Refugee Resettlement facilities. These children here without parents or family were rounded up in the middle of the night and put on planes to Guatemala. Lawyers on the ground described unthinkable scenes. Our staff, some who are here today, were party to this in the middle of the night, and one child said to their lawyer, "Why do they want to send me back? My mom is dead, and my dad abuses me. Why do they want to hurt me?" This was an actual conversation. These actions were illegal. Documents show that many of these children were in the country to escape trafficking in their homeland. Mr. Kennedy calls himself a protector of children. Some kind of rich claiming from somebody who's flown on Jeffrey Epstein's private jet on multiple occasions. I don't think Robert Kennedy should be within a million miles of this job. Republicans on the committee had a chance to prevent the public health train wreck that Mr. Kennedy has engineered. Everyone voted for him. It is in the country's best interest that Robert Kennedy step down, and if he doesn't, Donald Trump should fire him before more people are hurt by his reckless disregard for science and the truth. I also would like to note Senator Cantwell has joined us in this effort. I hope, at the very least, Robert Kennedy has the decency to tell the truth this morning. Mr. Chairman, I have a procedural request I'd like to make at this time. It's a short one.
Proceed.
Thank you, Mr. Chairman. Mr. Chairman, it's unfortunate that I have to say this, but this is a witness who has lied to members of the Senate Finance Committee. In response to over 35 written questions, including from me, he said, and I quote, that he would do nothing as HHS Secretary that makes it difficult or discourages people from taking vaccines. That was clearly not true. His unprecedented unilateral actions to restrict access to COVID vaccines, that alone proves it. He tried to fire the Senate-approved CDC director after she chose the truth over what I consider his delusions. His prepared testimony even today includes the debunked lie that 500,000 children disappeared under the Biden administration's watch, a lie that the Trump administration is using as a pretext to hunt immigrant children and their families. So, my request, Mr. Chairman, and I think it is unfortunate that I have to do this, but given the unprecedented nature of the witness's behavior, I would ask now that the committee formally swear in Robert Kennedy as a witness.
Senator Wyden, I will personally object and will reject your request. We will treat this witness as we treat all of the other administration witnesses who come before us. And let me just say again, as I said in my opening remarks, we will have some partisan disagreements today. We're having partisan disagreements right now, and I am having partisan disagreements with you on your characterization of the facts. The bottom line is we will let the Secretary make his own case in his opening statement.
I'll only say, Mr. Chairman, that this committee's unwillingness to swear this witness is basically a message that it is acceptable to lie to the Senate Finance Committee about hugely important questions like vaccines. I think it's a great mistake, and that's why I've made the request. I understand that you're not going to grant it, and we can move on.
We'll get to the bottom of your accusations, but at this point, I'm going to turn to our witness, the Secretary of Health and Human Services, Robert F. Kennedy, Jr. And Mr. Kennedy, Mr. Secretary, you may make your opening statement at this time.
Thank you, Chairman Crapo, and thank you, Ranking Member Wyden, for the invitation to appear before the committee today. Before I summarize what we've accomplished this year at HHS, I want to express my deepest condolence to the family of DeKalb County Police Officer David Rose, who gave his life to stop the gunfire attack on the CDC on August 8th. Officer Rose was a veteran. He was a husband and the father of 2 children. Officer Rose's widow, whom I visited, is expecting their 3rd child. I'd like Officer Rose's family to know that he remains in our prayers and that he will continue to be in our thoughts. Let me start with the big picture. Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true health care system that tackles the root causes of chronic disease. Chronic diseases reach crisis proportions in our country. And finally, we have an administration that is taking action. The Maha Report assessment, which the White House released in May, was the first government analysis of the key drivers of childhood chronic disease: ultra-processed foods, chemical exposures, physical inactivity, and over-medicalization. This month, we will follow with the MAHA report strategy, the Trump administration's solution for addressing each cause. At HHS, we haven't just been writing reports. We have been the busiest, most proactive administration in HHS history. In just half a year, we've taken on food dyes, baby formula contamination, the grass loophole, fluoride in our drinking water, gas station heroin, electronic cigarettes, drug prices, prior authorization, information blocking.
Those prior authorizations are it takes over 3 months to get a prior authorization. Senator Kennedy, do you know something?
The committee will come to order.
Between those 3 authorizations, you're killing millions of people. Prior authorization
I apologize to you for that outburst, Secretary Kennedy. I would notify everyone else in the audience. Comments from the audience are inappropriate. If there are any further disruptions, the committee will recess until the police can restore order. Mr. Secretary, please proceed.
As I was saying, prior authorization, information blocking, and healthcare interoperability. We're ending gain-of-function research, child mutilation, and reducing animal testing. We are addressing cell phone use in schools, excessive screen time for youth, the lack of nutrition education in our medical schools, sickle cell anemia, hepatitis C, the East Palestine chemical spill, and many, many others. At FDA, we are now on track to approve more drugs this year than at any time in history. I'm also proud to say that HHS under President Trump is doing more with less. We have taken measures to fight waste, fraud, and abuse. Just by eliminating duplicative enrollments in CMS, we are saving taxpayers $14 billion a year. Meanwhile, we are expanding access for people who need it. We are ending racist diversity, equity, and inclusion practices and instead focusing on aiding low-income and vulnerable families, regardless of their race, which was the original intent of Title X. We're also pouring $1 billion into Head Start and the Administration for Children and Families. Compassion need not be the casualty of efficiency. I'd like to highlight some issues that have not gotten media attention. First, we are doing our part to fulfill the President's commitment to stop human trafficking, especially of children. We inherited a terrible humanitarian crisis from the previous administration with its open border policies, which allowed the appalling loss that appalling tragedy can never happen again. We have knocked on 82,000 doors and located 22,000 of those children. I promise you that we will do more in the next 3 years. We are also addressing the disastrous health conditions in tribal communities on Native American reservations. I've met face-to-face with tribal leaders in dozens of communities and tribes in Alaska, Arizona, Idaho, New Mexico, and elsewhere. And I look forward to making HHS resources more available to those communities. One of the most significant initiatives under President Trump is the Rural Health Transformation Fund, part of the President's Big Beautiful Bill, which will provide the greatest investment of federal money into rural health care in history. Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality. And yet all those oppressive and unscientific interventions failed to do anything about the disease itself. America is home to 4.2% of the world's population, yet we had nearly 20% of the COVID deaths. We literally did worse than any country in the world. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. And that's why we need bold, competent, and creative new leadership at CDC. People able and willing to chart a new course. As my father once said, progress is a nice word, but change is its motivator, and change has its enemies. That's why we need new blood at CDC. That's also why it's imperative that we remove officials with conflicts of interest and catastrophically bad judgment and political agendas. We need unbiased, politics-free, transparent, evidence-based science in the public interest. Those are the guiding principles behind the changes at the CDC, and that is what you can expect all across our agency for the next 3 years.